Good evening. I am Justin Wilson, Mayor of the City of Alexandria, and I want to welcome you all to my February virtual town hall. It is hard to believe it has almost been a year since we started town halls. I appreciate all of you who have joined me each and every time. We were doing them weekly at the beginning of the pandemic, and since the middle of the summer, we have been doing these monthly. And I appreciate the engagement. It's a fun way to get some information out there and get a sense of what's on the mind of the residents of the city of Alexandria, particularly during these extremely challenging times. So I thank you for being here. Let me begin like I always do. As always, if you are ill, you feel like you have symptoms of anything, whether it's COVID or anything else, please contact your physician or a urgent care center or clinic to get assistance. Stay home if at all possible. Wear masks if you are out, and make sure you maintain physical distancing and wash your hands as much as possible. Those are the ways we continue to stay on top of this virus. And we're going to continue to need, even with some exciting information about vaccines, we're going to continue to need everyone doing their part to keep this virus at bay until we have a widespread herd immunity in the community. All right, let me talk a little bit about where we are. I'm going to start with the numbers and kind of give a sense of where we are at this point. And uh, and then we have a lot of information about vaccinations, and so I'll get into a lot of detail on that. And then I have a bunch of questions that have been submitted, and I'm happy to take questions that are submitted in the Facebook Live. So feel free to drop questions in there, and I will get to them before we are done. So far, we've now had in the city 9,574 total COVID cases. That is since the beginning. So we are nearing an important and unfortunate milestone of 10,000 cases. But the good news is we now have more people vaccinated than we have had cases, and I suspect we will stay in that position. We have seen 491 of our residents who have required hospitalization during their COVID case. And we've had, unfortunately, 105 of our fellow residents who have lost their lives due to COVID. A couple of things I want to talk about. So that the data has, after having seen a very significant spike after the holidays, both right after Thanksgiving and then into Christmas and New Year's, we have seen now a continuing down a decline since then, and that's been very good. We are on a good trend right now, and hopefully that continues. And I think it's a testament to the fact that we did see a very big spike because of the holiday gatherings that were occurring, unfortunately. And now that we've been able to keep those at bay, I think we've gotten to a much better place. Right now, our positivity rate is at 7.7% as of today. We were as low in October of 3.9%. And then we were up as high most recently in the 12% range, which is not where we want to be. So ideally, we want to be below 5%. That's where we want to keep it. That's usually the WHO, World Health Organization's line that they say is kind of a line for um, when you should proceed with further reopening. So we want to get back under 5%. Let me talk about vaccines. And so I think one of the confusing things has been just who is giving vaccines, and it's something that's also changed a little bit. So we started in phase 1A in December, and right before Christmas, we started into phase 1A. 1A was a very restrictive phase, and in 1A, the only people that could get vaccinated were healthcare workers and those residents and staff members in long-term care facilities. So these are the folks who are most at risk, have been most at risk throughout this crisis, and they were the only folks who were able to get vaccinated. And so in 1A, at least in Alexandria, there were really three entities that were doing that vaccination. So you had Inova that was vaccinating their healthcare workers and kind of healthcare workers that were in their orbit. And they did an enormous portion of phase 1A, and they were given direct vaccines from the state to do those healthcare workers. Then you had CVS and Walgreens, who received a contract through the Federal Center for Medicare and Medicaid Services, CMS, to do the long-term care facility staff and residents. That work is still continuing to this day, unfortunately, although most of them have been vaccinated at this point in our long-term care facilities. But that was done by these private pharmacies. They received a direct allocation and they did that work directly. And then separate from that, the city's health department was doing healthcare workers that were not affiliated with Inova. These are small medical practices, folks like that who fell into 1A. At the beginning of January, after we had kind of reached the end of 1A and we had gotten to the point where there was really nobody left to vaccinate in 1A, we were very much pushing the governor's office and the Department of Health and other folks at the state level to allow us to go into 1B, because at that point we had vaccine supply. We just did not have anybody to give it to because 1A had basically been exhausted. And so at the beginning of January, the first week of January, the governor allowed us to go to 1B along with a couple other jurisdictions in Virginia. So we were actually the first jurisdiction in Virginia to go to 1B. And 1B opens up the criteria quite a bit. And so in 1B, at least initially, 1B included those who were 75 and older, and then a whole bunch of frontline occupations, teachers, public safety, other frontline occupations that are childcare that are have been working throughout this crisis and need to get vaccinated early. So the CDC changed the guidance on 1B, and then the governor replicated that changed guidance, which basically added two additional groups to 1B. And so that added those who were 65 to 74, and then it added those who were 16 to 64, but have a high risk health condition. And so now 1B as a whole comprises almost half the state. It is an enormous category. And the challenge right now is we have no vaccine. We do not have vaccine supply to do anywhere near what we need to do. The city, and I have to constantly repeat this both on social media and in Facebook and or in emails and other things. The city has plenty of capacity to administer vaccines. We have plenty of capacity. We've been planning for this vaccination effort for months. We have staff from all over city government. We have partners in public safety agencies outside of city government. We have private partners in pharmacies and physicians and others who are all ready to give out this vaccine. And we have considerable capacity to do so. And once we have doses, we will be able to do tens of thousands of vaccines per week. Unfortunately, we have no doses to be able to do that with. So far, right now in the city of Alexandria, there are 12,773 Alexandrians who have received at least one dose of the COVID-19 vaccine. Now, that includes residents who have been vaccinated in other jurisdictions, as well as residents, and then we are vaccinating folks who also live in other jurisdictions. So in 1B, if you qualify for vaccination because of your age or your health condition, so you are in those categories of 16 to 64 with health issues, 64 to 74, and then 75 plus, then you receive it in Alexandria if you live here. If you qualify due to your occupation, so you are a police officer, you're a teacher, you're a child care worker, you receive it where you work. So obviously, if you work and live in Alexandria, great. But if you live in Alexandria and say you're a teacher in Prince George's County or Washington, D.C., you will receive your vaccine in those jurisdictions, not in Alexandria. And I think that's been a challenge very early on. A lot of our Alexandria residents who qualify for vaccination in 1B were frustrated that they could not get vaccinated here. They get vaccinated where they work. Conversely, we have done a ton of vaccinations of our own public safety employees, healthcare workers, and others who work in Alexandria but live in other jurisdictions. And so, particularly early on, when we were 1A and our early 1B, when we were doing teachers, when we were doing police officers, firefighters, sheriff's deputies, an inordinate number of those folks live in other jurisdictions. So a good chunk of our early doses were actually for residents of other jurisdictions, but they're folks who serve our community in these frontline roles. So 12,000 folks who have received it in the city. We have 1,660 Alexandria residents who are fully vaccinated. That means they've received both doses. And then we, as our health department, has received 13,000 Moderna doses. Now, I think this is part of a thing that has confused a number of folks. So if you look at the Department of Health's website right now, it says that in the Alexandria Health District has received 22,675 vaccine doses. That's not the number of doses that our health department has received. That means that everyone in Alexandria, any entity in Alexandria that's doing vaccinations, has received a total of 22,000 doses. A big chunk of those went to Inova early on in the 1A phase, and other entities that received doses directly. So it's a little deceptive to see those numbers. Our health department, as of last Friday, has received 13,000 total. Of those 13,000, 8,600 have been administered at our clinics. These are first doses that we've given at our clinics that we have been hosting regularly. 4,100 of them have been given to physicians and pharmacies. We have a number of physician and pharmacy partners that we are working with, and then they are administering them to their patients. And then as of last Friday, 207 of them were for scheduled appointments that happened this past week. So those are already gone. I cannot emphasize this enough. We have as of last Friday, over 30,000 residents on the waiting list. And what we have been notified by the state right now is that we are going to receive a little less than 2,000 doses per week. So just to give you an idea, 30,000 people on the waiting list, little less than 2,000 per week for the foreseeable future, the next month or so. That means that this is going to take a while, and I think everyone kind of needs to brace themselves for that. That at the current pace, unless something dramatically changes with the supply of doses that we are receiving from the state, it will be until into the summer until we are able to get through 1B. And I think that's an important a note for everyone to understand, because I think everyone is now signed up, which is great. We encourage you to sign up if you are eligible for 1B, 1C, or even 1A. Please sign up so that we know that you're there. But it's going to take some time before we have a dose available for you. And we are prioritizing those highest at risk in those categories. And I'll talk a little bit about that later. So let me talk a little bit about, and let me just note that we do have a registration form. If you go to alexandriava.gov/coronavirus, there's a registration form available for vaccines. So if you have not registered yet and you're in that 1A, 1B, or 1C category, please do so. Moving off of vaccines for a second, although I will probably come back to it with some of the questions. We launched a new testing initiative last month. As many of you know, throughout most of last year, we were using Neighborhood Health as a partner to do testing, regular pop-up testing around the city. Given that now Neighborhood Health will need to move into a vaccination effort, particularly for some of their targeted populations, we brought in Curative, which is a vendor that has been doing testing around the country, and they have set up 3 pop-up testing stations that are in Chick Armstrong Recreation Center, the old Cora Kelly Recreation Center, Brenman Park, and Charles Houston Recreation Center. And these are available 6 days a week at 2 of the sites and 7 days a week at 1 of them. So there is always testing available in the city of Alexandria. It's free testing. They will bill your insurance if you have insurance, but if you do not have insurance, is free testing. So please take advantage of that. The governor did extend further his orders that he had done in early December, which limited gatherings a little bit more, expanded the mask mandate, had an alcohol curfew at restaurants, and then closed businesses as well at midnight. And so that remains in place. And I imagine until we have numbers that are in a better position, that will probably remain in place at the state level. I get a lot of questions often about the state of our hospital. That's been something we were concerned about from the beginning. So let me give you kind of an overview there. So first of all, Inova itself as a system has vaccinated a ton of folks, and so they have been a very critical partner in doing vaccinations, particularly for those healthcare workers in 1A, and then targeted populations going forward. And I think you'll hear a lot more as we get vaccine doses about the role Inova will play in that. At Inova Alexandria Hospital right now, they are at about 70% of capacity. That's a perfectly normal place for them to be, if not a little low. They have 35 COVID patients at Inova Alexandria right now. They have two other folks who are under patients under interest, patients that they think might be COVID, and that's what they have there. So far, they've tested over 203,000 folks over the course of this year. Of those folks, 23,000 folks have tested positive, 178,000 have tested negative. They've had 703 deaths at Inova facilities. This is overall, not just Inova Alexandria. They have overall right now 185 total at all Inova facilities, and then they have discharged 6,500 people at Inova. So I previously talked about the CARES Act money that went away at the end of the year. We had focused on that money for housing assistance, food assistance, small business assistance, nonprofit assistance, and the city expenses, as well as some work with ACPS and sponsoring some of their programs. That money went away at the end of the year, so it is no longer available to us. However, we'll see what comes out of Washington right now. There is obviously the president has proposed a package which has a substantial local and state government component. Our hope is whatever ends up coming out of Congress and signed by the president is something that, again, includes a substantial component for local and state assistance. Obviously, when we get that money, we'll put it to good use. We did extend using local dollars, the emergency rent relief program, as well as our food assistance efforts through the beginning of the year, and so we'll be funding that locally. I should note that we were with Alive, one of our community nonprofits, a couple of weeks ago, and they told me they are now providing in 1 month what they used to provide in a year for food assistance. And so I think it gives you an idea of the significant need that has developed in our community, and we'll continue to work to address that. We are going to be starting our budget process in a couple of weeks here. And I think obviously we have been expecting a significant financial impact from what we've seen in COVID. We had an estimated between 2 fiscal years, 91 million that we were facing of revenue loss last year. And this current fiscal year ended up not being as bad as we thought, but the real estate market was where we expected to see really big impacts, particularly on the commercial side. Our assessment report that we're going to be receiving on Tuesday just came out a couple hours ago, and so you can see on the residential side we have two very different stories now. So on the residential side, we've actually seen a very healthy rate of growth on the residential side, and I think those of you who have tried to purchase a home in the city recently or seen the sales in their neighborhood, that's the case. Sales prices are hanging in there. They seem kind of immune on the residential side to what's going on in COVID. On the commercial side, it's pretty ugly. We have, for example, hotels. The hotels in the city of Alexandria lost a third of their value, a third of their assessed value this year, which is breathtaking. Just an amazing amount of loss for one property type. And then the rest of the commercial tax base saw other very significant decreases. So we have some of the most healthiest residential growth we've seen in quite some time, and some of the largest commercial drops that we've seen in quite some time. And so that's going to present quite a challenging environment for our budget process that comes out in a couple of weeks, and the manager will be proposing his budget, and then we adopt at the beginning of May. And so we'll have a substantial amount of community input, budget public hearings, et cetera, so the public can weigh in on the budget proposal. All right. At this point, I have gotten through what I want to talk about, and so I will go through some questions here. I have a number that were pre-submitted, and then I know there's been some that have been put in the group here while I've been talking. So Alex asked, is it possible for the 200 million vaccines Biden promised will help us or help carry us towards vaccinating those 16 to 64-year-olds with pre-existing conditions more quickly? The short answer is we hope. I think we, obviously there's a lot of good movement right now at the federal level to try to free up additional vaccine supply for the states. It's going to take a bit, I think, is the short estimate that we've heard. So yes, hopefully when we get some share of that 200 million, we will be able to get those and put them to good use. And the 16 to 64-year-olds with pre-existing conditions are the third kind of priority for us within 1B, and so that's how we'll approach that. Charlotte asked, with the new Virginia Department of Health distribution strategy of repurposing some second doses as first, how is AHD ensuring, promising that people receive their second dose on time? So this has been an interesting discussion. I think at this point, we have not been given authorization to repurpose any second doses that we don't have identified second doses, or sorry, second doses that we have not identified a backfill for it. And that effort that you heard at the state level to repurpose some of the second doses that were in the federal program, the federal pharmacy program that I mentioned earlier, that didn't have as big of an impact on Alexandria. That was more an issue for other jurisdictions. So we still have second doses coming for all of the folks who have received first doses, and we, everyone who's received a first dose, you will be contacted to schedule the second dose. And I've heard from a number of residents who are concerned about that, and then they later receive contact. So we are definitely contacting those folks, making sure they get their second dose, and we're not in a position where we are grabbing second doses and applying them as first doses, which would create a situation where we don't have second doses. So we're not doing that yet. We'll see if that's a change of a policy at the federal level or state level, but at this point, that's not been the case. Renee said, we've recently experienced a steep decline in positivity. Great. Have we concurrently increased testing with a new testing boost? And does that account for some or all of the decline? Also, what percentage of our samples are being sequenced to check for mutations? Are enough samples being sequenced for us to know whether infections with a new contagious mutations are in a growth trend, being masked by our decline, or in top line positivity? So good question. I guess the short answer is we saw a big uptick in positivity, or sorry, in testing volume before and then after the holidays, and that went down a little bit, and now it's going back up a little bit. But I think a lot of the reduction right now is not just from testing volume going down. I think it's more from a lower prevalence of the virus in the community. And that would be my guess, uneducated, not an epidemiologist, but just from looking at the data. As far as sequencing to check for mutations, I'm not as familiar with kind of how they do that surveillance. I will say that the state has announced when they have seen some of these other strains here, and they've already announced a couple of those at various points. But we've not seen a lot of data on that quite yet. So I think it's still kind of very early right now in those other strains becoming prevalent here. So we'll probably get some more information from the Department of Health as that goes. Janine said, how is the health department choosing whom will be vaccinated? Are 65-year-olds and 74-year-olds equivalent? Or is there an attempt to do the oldest first? What measures are being taken to get a fair share of vaccine in Alexandria? Let me take the third part first, or the last question first. So, we have been advocating from the beginning for an increased supply of vaccine. Early on, the state was allocating the vaccine based on request, based on demand, based on how quickly you could administer it. And I think early on, there was wide divides of how prepared jurisdictions were around the state. I think in Northern Virginia, you saw a bunch of jurisdictions that were on the ball, ready to go, ready to administer vaccines. And same thing in Tidewater and some areas of the other areas of the state. But in a lot of areas of the state, you had communities that were just not prepared to do that. And so early on, a lot of the vaccine was going north, it was going southeast. As everyone else got up to speed, the state ultimately made a decision to do the allocation per capita. And that unfortunately lowered the amount that we were getting here in Alexandria. And so I think that's going to be the case for the foreseeable future until the supply increases quite a bit. I mean, the issue now is a supply issue for the state. I think there's been a lot of data issues and data reporting, and kind of, I know many of you have contacted me about reports that show, Virginia last or next to last. And I think Virginia had a very significant reporting problem. We had probably some administration problems too, around the state, but we more than anything had a very significant data reporting problem. The governor appointed a czar from the Richmond Health Department, who's now in charge of all of vaccinations around the state. He has largely fixed the data issues. Now, if you look at the national rankings, Virginia's in the top 15 now nationally in the number of doses that have been administered. And so they've gotten the data caught up. And what it shows is that we really just don't have doses. We need a lot more doses. And so I think that's hopefully something that will be fixed in the next several weeks. As far as the how we're prioritizing, so we are prioritizing those that are 75 and older. They go first within 1B. Then we're prioritizing the folks who are 65 to 74. They would go next, and then the folks who are 16 to 64 with the health conditions. And so that's really the way that we're prioritizing at this point. That will probably change as we continue, but that's the way we're doing it right now. And one of the things I neglected to talk about earlier, and this is probably as good a time as any, is 1C is next, and 1C is huge as well. And if you look at 1C, it's mostly occupational. It's different occupations, a whole bunch of different occupations. Let me say that looking at a 1C, I can say that it's going to be a mess to try to administer 1C because it's just much more detailed occupational verification that'll have to happen. It's not like you're either a healthcare worker or not, you're either a police officer or not. It's lawyers and all kinds of other things that telecommunications that fall into 1C. And so my request and what I personally asked that vaccine czar that I mentioned earlier a couple days ago was that when we get to 1C, we basically just open it up. As I said, we pretty much have half of Virginia in 1B and 1A. And so when we've completed that, I don't really think there is a reason to continue to be strict about how we're administering at that point. So my argument is that when we get to 1C, it should just be indiscriminate. Dr. Avula, who's the coordinator for the state, he said he actually agreed. And so that's his recommendation as well. And so we'll see what ultimately the governor decides. But that would be my hope, is that once we've completed 1B, we'll just get to a place where we can administer to anyone. I think it'll make it a lot easier. It'll make it a lot quicker. But ultimately, the missing ingredient is the doses. And so we just need to get the supply. All right. Carolyn asked a couple of questions. Should residents of Alexandria be placing their names on various multiple COVID-19 vaccination signups in the region and throughout the state? Will people be allowed to have 2 different series of vaccinations? How will this be prevented? I've read various places that 2 series might just give more protection against the variants. How is vaccination record keeping being handled in Alexandria in conjunction with the state record keeping concerning the COVID-19 virus? Is the data being reported accurate? So let me start backwards. So the data, data has always been a kind of work in progress from the beginning. Early on, the COVID case data and deaths and hospitalizations was very messy. It took a while to get refined. I think we're in that same phase on vaccination data, getting better, still not great. It'll take a little bit to get refined. On placing their name on multiple lists, I would never tell you not to. But the city has the list that we are using for the city, and then we are partnering. We are providing folks, and I'll talk about this later because I have a question about this. We are providing our partners with information from that list. So you sign up with the city. There is a state list, but that is really just feeding into the city's list. And then as some of these private pharmacies are starting to set up lists of various kinds, again, unless they have a separate supply, which is going to be some discussion, we'll see, then I'm not sure what benefit that's going to ultimately be. But I think that whole the private pharmacy role and the fact that they might get some direct supply is something that just came up this week and a little bit of a surprise to us. We're waiting for more details on that. So the next question actually from Linda was for tonight's town hall: when retail pharmacies start providing vaccines, do we schedule directly with them, or will the Alexandria Health Department coordinate appointments? Again, I think it's going to depend on whether those pharmacies get supply. So what I saw is the announcement that CVS was going to be a bunch of CVS locations were going to be vaccinating. They were getting direct supply from the federal pharmacy program, leftovers from that. There wasn't a location in Northern Virginia that I saw. They were mostly in the rest of the state. And then I heard that they were going to be allocated 27,000 doses to all over the state, all over Virginia. Just to give you an idea, 27,000 is um, it's about now half of what, maybe 2/3 of what the state is administering across the state in one day. So it's not a very extensive amount of doses. I think that was probably more of a PR thing than anything. That's just my assessment, but we'll see as those if those pharmacies are able to get access to more supply. Our city health department has pharmacy partners, and we are providing vaccines to those partners, and they are then administering those vaccines to people who have signed up through the city that we are giving them. And that actually is the answer to this next question. So Daniel said, can you explain the process a bit for how Alexandria is administering vaccines? My mother, over 65, received a call after pre-registering from a local pharmacy saying she was on their wait list and invited her to come in the event that they have no-shows. She did and got the shot. How are you determining where, when pre-registered folks will get shots? Was her name given to this pharmacy and this pharmacy alone, or was she eligible for many sites? So yes, her name was given to this pharmacy and this pharmacy alone. We have, again, we have pharmacy partners that we're using. We have given them lists of people who have signed up, who are on our prioritized list. They are contacting those folks, scheduling them for appointments, or we are contacting them, scheduling them for appointments, and then they're going and getting their vaccine. And so we will continue to use pharmacy and physician partners throughout. We have many more identified. Again, the issue is supply. We just need additional supply. All right. Let's see here. Brian said, okay, so that's the last COVID question that I have that was pre-submitted. I have a number of non-COVID questions I'll start going through now as well. This one's a doozy of a question. Brian said, do you feel the decisions on where to add affordable housing are equitable? I am for affordable housing, but I'm concerned that I've seen a great deal of construction in classic Old Town and areas like that, while others are seeing building and proposals at a denser rate. Just because some communities, aren't as organized or vocal as others, doesn't mean this housing shouldn't be distributed equally around Alexandria. This is a great question, and one that I could probably talk for several hours about, and I'll try to be as quick as possible. There is a lot of history to how particularly committed affordable housing has been placed around our community, and there is no question that there has been inequities associated with that. Today in the city of Alexandria, most of the committed affordable housing, these are units that are owned by our public housing authority and other nonprofits and others. Most of that is on the east end of our city. A lot of it in Parker Gray and the outskirts of Old Town, North Old Town. And then we have a couple scattered sites on the west end and other places. And then we have some newer affordable housing that is owned by nonprofits on the west end in various places. Most of the market rate affordable housing, the naturally occurring affordable housing in our city, these are privately held affordable housing, is on the west end of our city. And that's primarily driven by a function of density and when kind of multifamily housing was built and where it was built in the city. Older garden style apartments and high rises that were built decades ago and constitute a big chunk of our market rate affordable housing. As we go and we place new affordable housing in the city, it's a function of where property is available, where you can get inclusionary units from developers, and then the land use, what the land use allows, what zoning allows. And so in Old Town, in kind of the old historic district in Old Town, we don't have as much of the newer kind of committed affordable housing, largely because the level of density. We have a 50-foot height limit in the old historic district, and so the level of density that is allowed in that area doesn't really allow it from a financial perspective. A lot of the newer committed affordable housing that's been developed in the city is going on the west end or in near me in Arlandria and other places where we can get property that is more affordable. The city actually is along with a couple other jurisdictions is participating in a fair housing study right now that's basically implementing or trying to implement the rule that the Obama era Housing and Urban Development Department had promulgated, basically trying to further fair housing law and trying to prevent and ameliorate some of the segregation that's occurred in our communities. And we're doing that in partnership with a number of other jurisdictions around the region. And so when that comes back, we'll have a real conversation about some of those findings, some of which I think will be obvious, and then how we address those. So thank you for the question. It's obviously one that we could talk about for quite a while. Pam asked, speaking of transportation, any update on when WMATA may be returning the 8Z and 8W in their schedule, or are these routes gone for good? We emphasized when Metro made their cuts that we wanted to make sure those cuts were not for good. Obviously, bus and more so heavy rail, Metro rail transit has been decimated. Ridership has been decimated by the pandemic. The buses have actually done better than Metro rail, but still ridership way down. Metro's received a fair amount of money now from the feds to try to keep them afloat. They got money in the last bill, and then they got money in the first bill. But ultimately, there's going to be a reckoning this spring if there's not more money coming from the feds. So I think the short answer is my guess is we'll see those routes return when ridership returns, and so hopefully we'll get to a place where ridership is coming back, and we'll be able to bring those routes back. And we'll certainly work with WMATA to make sure that happens. Matt asked, several cities have pushed back on Comcast new data fees. Comcast in the Northeast has delayed the implementation until July. In any case, there is no real competition in Alexandria for high-speed internet. If Comcast can change its rules to customers midstream, can the city revise its agreement with Comcast or insist to keep the status quo? Between Zoom meetings and YouTube TV, we are using a lot of data. So I absolutely agree that it's very frustrating to see Comcast put this new policy in place, particularly now. And I've expressed my concern to Comcast about the new policy that they put in place. It's basically data caps. They provided information that suggests there's a very small number of customers in Alexandria that would be impacted by this. But I think in the end, it's just not great timing. Like you said, I understand they've paused it now, paused implementation of it. We are going to continue to express our concern. I think our big picture answer for this is competition. We need competition for cable in the city and internet, and that's what we're working on. So we continue to work through our municipal broadband effort. We actually just went out to market again and closed on bids, and so hopefully we'll be awarding a contractor to go out and build a municipal fiber network for the city, which is our first step to trying to bring some competition here to the city. So more to come there. All right, let me go to questions that were submitted in the chat here. Darylyn said, "Can we request more than 2,000 doses a week?" We were requesting 10,000 doses a week. Unfortunately, we were receiving 2,000 to 3,000 initially, and now we're receiving less than 2,000. So we are certainly asking for quite a bit more than we are getting. But then again, everyone is. And so I think that's part of the challenge now is they just don't have the doses to give us. Gina said, "Can't we get more based on our very dense population, especially for targeted populations?" Well, unfortunately, they are giving it to us based on our population. That's how they're doing it around the state. They're giving it per capita. We were preferring early on that they continue to give it based on how quickly we were going through it, which is how they were doing it at the beginning, because we were going through it darn quickly. And unfortunately, they switched back to doing, or they switched to population. And so I think until we get until the national supply issue is sorted through, I think we're going to be in this boat for a while, unfortunately. And so hopefully the efforts of our president to increase supply are going to be successful. Keith asked, have there been any layoffs of city employees? No, there hasn't. The manager proposes his budget next week, and we'll see what he has proposed. Sandy said, I got my first vaccination yesterday at Van Dorn Pharmacy. Who chose that site? I've never been there before. Hadn't heard of it. A very tiny space, so it was sort of weird. So who selected that site? So Van Dorn Pharmacy is brand new, and they are one of our best partners of the health department. So the health department has worked throughout the city to identify pharmacy partners, as well as grocery partners, as well as different sites we would do vaccinations once we have doses, as well as physician partners. And these are folks who have gone through a process with the health department. They have faith in their ability to administer this and ability to manage the doses, make sure they adhere to our zero waste protocol, which is almost the most important thing, that we not waste a single dose. And we so far, knock on wood, have been able to do that so far, and we want to keep that. And so that's how these partners are being chosen. So Van Dorn Pharmacy has been a great partner for us. You've seen they've gotten some press out of it too. Julie Carey did a story a little while ago about them, and I think it's because they're doing a great job, and we're going to continue to use them as well as other pharmacies around the city who have been really, really good partners working with the city. Pam said, can you remind people that Alive will be hosting a housewares collection day this Saturday from 8:30 to 11:30 at Fairlington United Methodist Church at 3900 King. Go to Alive, www.alive-org.org. The website has information about food distribution dates as well. So yeah, please drop off your housewares. I'm planning to deliver a great deal from our house, probably more than my wife's aware of, but we'll make it happen. So Mary Lee thanked me for getting the word out about second doses. Mary Lee is Executive Director of Senior Services of Alexandria. They've done a great job in working with our senior population. Linda talked about the 1C. Darylyn said, do you have an outreach vaccination plan for Black and brown constituents in the city? Yes. So I think a couple things. So obviously there's been some data that's gone out around the country, and then we have some statewide data that shows already some significant disparities in vaccination administration for Black and brown residents. And there's a couple of things that have accounted for that early on. So some of that was the selection of the Phase A priorities, the Phase 1A priorities, that you had long-term care facilities prioritized, and particularly some of those facilities, access to long-term care there's a real inequity in that for Black and brown residents. You also, as you focused on 75 plus early on, and even 65 plus, our Black and brown population is a younger population than our white population in Alexandria, and so those disparities were certainly present in that population. We have our efforts to try to deal with that are using a number of community partners. So we have a number of organizational partners that our health department has built relationships with over the last year. I mentioned one of them, Neighborhood Health, earlier. That serves primarily our immigrant community or Latino community in the city, and so that's how we're trying to address some of those inequities going forward, is using our community partners to make sure that we get access to vaccines for those folks. Once we get supply at a higher level, we'll do a lot more of the pop-ups in various neighborhoods, like we did with testing throughout the pandemic. And we'll do efforts where we go out and do, vaccinating a group, vaccinating a building, vaccinating whatever, trying to make sure we address some of those efforts. The other side of this has been trying to address vaccine hesitancy. All the data shows that there is much higher rates of vaccine hesitancy in Black and brown communities. And I think we have a role to play in that. You may have seen we did a YouTube virtual town hall last week with a number of our community partners who serve Black and brown communities in our city, focusing on vaccine hesitancy and trying to provide good science-backed information to populations in our community to make sure they are aware that the vaccine is safe. It is safe for you to take. And I think particularly with our Black and brown communities, we're dealing with generations of well-deserved mistrust, particularly as it relates to vaccines, whether it's Tuskegee and other experiments throughout our history. And so we have to redouble our efforts to make sure we address vaccine hesitancy, particularly in populations, some of our Black and brown populations that constitute a big chunk of our frontline essential workers in healthcare and grocery and restaurant, retail, et cetera. Those are folks that, in order to slow the spread, we're going to need to get those folks vaccinated. So we need to attack hesitancy from the beginning. So, and we will continue to do that. Thank you for that question. Paris asked, my mom is 58. What underlying conditions, what category, with underlying conditions, I assume, what category does she fall into? So if she is 58 with an underlying health condition, and there's a list that we publish, then she would be in 1B. She would be in that 16 to 64 category. And so I encourage you to go to our website alexandriava.gov/coronavirus. Click on vaccines, and there's a registration form. You can sign her up now. As I said, we got over 30,000 people who are signed up, so it will be a while, particularly in the category she's in, because she'll be in the kind of third tier of that category. But please get her signed up. We want to know about her existence, and we want to make sure we notify her when we have a vaccine dose available. So please make sure she's there. All right, that was the final question I have. I don't see any others, so I will I'll give folks one more shot at that. But I do want to thank everyone for being a part of this this month. I will continue doing these monthly as long as it's interesting for folks. And I did have some folks email me last week and say I should go back to doing weekly. I'm not sure we'll be able to pull that off right now, but I think if we get to a place where there's a ton of information that I need to get out there, I'll try to increase the frequency as necessary. But thank you so much for being a part of this. If you have the ability to volunteer, please go either to Volunteer Alexandria, volunteer@alexandria.org, and sign up. They have a list of volunteer opportunities. We are also still looking for volunteers for our Medical Reserve Corps. Our Medical Reserve Corps is an all-volunteer effort on the part of the city, and it's for both people that have medical training as well as people who do not have medical training. And our Medical Reserve Corps has been critical to our testing and vaccination efforts throughout this crisis. And as we ramp up our vaccination efforts, hopefully with a lot of additional doses, we will need ever more volunteers. We need people who actually do the vaccine, so we need folks with medical training, but then we also need folks to do a lot of other roles that don't require medical training. So please sign up for a Medical Reserve Corps if you have time to spare. If you have money to spare, please go to actforalexandria.org and contribute to what's now called our Resilience Fund. It was our COVID-19 Response Fund. They're working very hard to put information out to the community, put resources out to the community, to our nonprofits who are helping address some of the significant need that is sprouted up during this crisis. So thank you very much for joining me this month. I appreciate it. Please stay safe. And if you have any questions, please drop me a line, justin.wilson@alexandriava.gov. And I look forward to seeing you again in March. Thank you very much.